Hi guys, my name is Marion and I'm a resident orthotist at UW Health, University of Wisconsin Health in Madison, Wisconsin. So I chose prosthetics and orthotics, also called P&O, because I've always found it fascinating ever since I was a kid. I don't know anyone who uses a prosthesis or an orthosis. I just thought it would be cool. I made them for my dolls. So that's why I picked this field. The training and education that we need to be a prosthetist or orthotist, that's what it's called, is we need a master's degree in prosthetics and orthotics, but you could also be a technician, and that would require a program at a junior college. And so not everyone has to be a clinician. You could also be a tech. I personally, I'm training to be a clinician, but I love tech work. So it's really important for me that I'm able to continue to do tech work as I continue my training to be a clinician. And then the skills needed to be a CPO, certified prosthetist orthotist. You need to be able to work with your hands. You need to be creative, good with people because we work with patients. But these are all things I think that you can learn on the job. I like to get my hands dirty. I'm wearing scrubs today because I was in the lab, so I'm kind of covered in plaster dust. But I love it. I think it's fun. Also, like I said, even if you don't have, for example, the best hand skills working with machines and stuff, you can be trained during residency and at school. So if you have zero experience, you should still apply. Don't let that hold you back. Equipment, tools, and uniform. So like I said, today I'm wearing scrubs, but normally I wear business casual. So it's a little bit fancier. I feel like I'm dressing up, but you know, it looks nice and I blend in with everyone else. Sometimes at school we get to wear a lab coat when we work with patient models. And as for equipment and tools, we use a lot of power tools, like an air chisel, or sometimes we hammer things out by hand. I use a cast saw, screwdrivers, hammers, a staple gun. We do a lot of work with plaster and fiberglass when we wrap stuff up. We use a whisk for mixing plaster at school. And then we have a lot of like machines, big machinery, so like grinders, sanders, band saw, different stuff like that. Challenges I personally overcame to get here. I began my career actually as a Spanish professor. And so when I realized I should have just followed my heart and done prosthetics from the beginning, I had to take a couple extra classes. But that didn't hold me back. You know, I kept working and taking classes at the same time, and then I applied to prosthetic school, and now I'm a resident. And other than that, I would say sometimes at school I had a little trouble following kind of like the biomechanics because I'm not an engineer, but it was fine. Teacher was great and answered all my questions. How long did it take to get here? So I took a little detour studying Spanish. But if you take a more traditional route, you could do 4 years of undergrad and then 2 years of your master's, and then start your residency to become a certified prosthetist and orthotist. Or if you want to be a technician, which is equally as cool, you could go to junior college. Joliet Junior College has one in Illinois, and you could do that program, and then you could work as a technician. What did I learn in school that I use now? So when I was studying Spanish, I learned Spanish, and I'm actually still using that because I'm able to interpret for Spanish-speaking patients at the different practices. I was able to do it at school when I did clinicals, and I actually did it at my very first week of work 3 weeks ago. I was able to interpret for a Spanish-speaking patient, and then I translated some COVID-19 health questionnaires into Spanish. And then as for prosthetics and orthotics, a lot of what we, like basically everything I learned at school, we're using now. So, you know, like anatomy and different kind of like ankle joints and knee joints and what goes where and why and how things work. So all very relevant. And then any advice. My biggest piece of advice for you guys, if you're thinking of joining us as prosthetists and orthotists, is that you do not have to be an engineer. I'm sure it's helpful, but I was very successful at school and I'm not an engineer, and many of my classmates were not either. So if you don't love engineering, you don't think you want to major in that in school, that's okay, and don't let it hold you back. Also, if you want to pursue a liberal arts degree like I did, don't let that hold you back either. Well, it was nice speaking to all of you. I hope you're well and enjoy the rest of your day. Bye.